Welcome to this explainer. Today, we're diving into the fascinating and honestly sometimes pretty dangerous world of REM sleep behavior disorder. We'll be drawing our insights directly from a clinical educational script provided by My Sleep Scoring, really unpacking the science behind what happens to us when we sleep. Let's get right into it. We're starting off with a wild biological mystery. Just imagine for a second, what actually happens when the invisible shield that protects you in your sleep suddenly just vanishes? What happens when you physically start acting out your absolute most violent, intense dreams right there in your bedroom?
Part 1, the baseline, normal sleep, and the invisible shield.
Okay, before we can figure out what goes wrong, we've got to understand how normal sleep is actually supposed to keep us safe. You know that during REM sleep, rapid eye movement, our brain activity is off the charts, and that's when our most vivid dreams happen. Well, to protect us from ourselves, our body enters the state called REM atonia. It's basically an intentional, protective paralysis of most of our skeletal muscles. It's the brain's brilliant way of putting us in lockdown so we absolutely cannot act out whatever crazy dream we're having. Here's how this biological shield actually gets raised. First, REM sleep begins. Right on cue, specific circuits in your brainstem, specifically the pons and medulla, start firing off these inhibitory signals downward. Those signals travel down to the spinal cord, where they actively hit the brakes on your motor neurons. The end result? Total muscle paralysis, keeping you safely tucked in bed.
Part 2, the breakdown, when paralysis fails.
But in some folks, this absolutely vital neurological process just breaks down. This malfunction is formally known as REM sleep behavior disorder, or RBD for short. It's a parasomnia that happens when that normal protective muscle paralysis simply fails to kick in. The person is no longer paralyzed. Instead, they are literally, physically acting out whatever intense, vivid dream is playing out in their head.
And the behaviors that come out of this are incredibly dramatic. Instead of just lying still, patients might start talking, shouting, or swearing out loud. They might be punching and kicking at the air, or even jump completely out of bed. The movements are often violent or defensive, mostly because the dreams in RBD are totally action-packed. Patients constantly report dreaming that they're being chased or attacked, so their physical body in the real world is just desperately trying to defend itself.
Now think about the human side of all these clinical facts. Often it's actually the bed partner who notices there's a problem first. The patient themselves, they're usually fast asleep, completely oblivious to the fact that they're throwing punches or yelling, which leaves the partner to discover the disorder. Imagine waking up to that. It's an incredibly shocking way to wake up, for sure.
Part 3, the investigation, diagnosing the dream enactment.
So, how do clinical detectives actually piece this together? You might hear about this and initially think, oh, they're probably just sleepwalking. But they're totally different things. Sleepwalking happens during non-REM sleep, usually much earlier in the night. RBD, on the other hand, happens during REM sleep, which is typically later. What about sleep apnea? Well, that can definitely cause thrashing, but it's a physical struggle to breathe, not someone acting out a dream. And nocturnal seizures involve very specific, stereotyped electrical activity in the brain. They all look a bit similar on the surface, but biologically they're happening for entirely different reasons.
To definitively crack the case, having a quick chat in the doctor's office just isn't going to cut it. Relying on clinical history alone is never enough. Doctors absolutely have to use the gold standard test, a polysomnography, which is just the technical term for a sleep study. They need to get the patient into a lab and monitor exactly what the brain and muscles are doing while they're asleep.
And during that sleep study, the absolute smoking gun they are hunting for in the data is something called REM sleep without atonia. Basically, they're looking for increased electromyographic, or EMG activity during that REM phase. It's the mathematical proof that muscle tone has come back exactly when it was supposed to be completely shut down.
Part 4, the hidden clue, uncovering the neurological risk.
Nailing down this diagnosis is absolutely crucial because RBD often acts as a hidden clue pointing to a much bigger neurological picture. Doctors split the disorder into two main categories, secondary and idiopathic. Secondary RBD means it's triggered by something known, maybe a brainstem lesion, an existing neurodegenerative disease, or even side effects from medications like antidepressants. But idiopathic RBD, that's the tricky one. Idiopathic just means the cause is a total mystery at the time of diagnosis, and it requires some serious long-term neurological monitoring.
And here is why that monitoring is so important. Research shows that idiopathic RBD is strongly associated with the future development of conditions called synucleinopathies. We are talking about major neurodegenerative diseases here, like Parkinson's disease, dementia with Lewy bodies, and multiple system atrophy. Essentially, idiopathic RBD acts as an early biomarker,
waving a red flag that these conditions might develop years or even decades down the road.
Actually, let me pause right here because I want to emphasize a direct quote from the clinical experts. This does not mean that every patient with RBD will develop Parkinson's disease. It is incredibly important to remember that while this is a significant long-term risk, getting an RBD diagnosis is not a guarantee that you're definitely going to develop Parkinson's. It's a risk factor that needs to be watched, not a crystal ball.
But because that long-term risk is real, doctors will keep a very close eye on idiopathic patients over the years. They're going to be watching for these really subtle early warning signs of neurodegeneration. And honestly, it's stuff you might not even link to your brain or sleep at first. Things like a loss of smell, unexplained constipation, maybe some subtle motor slowing, or slight cognitive changes. Spotting these tiny changes early is the real key to getting the best possible patient care.
Part 5. The resolution. Safety and treatment options. So going back to the immediate danger of the sleep disorder itself, how does modern medicine actually manage this? Well, safety is always step one. Before anyone even brings up medication, you have to fix the environment. Because this dream enactment can be so violent, simple bedroom modifications can be a real game changer in preventing severe injuries. We're talking about padding the floor near the bed, taking sharp objects right off the nightstand, lowering the bed, using bed rails, or, even sleeping in separate beds if that's what it takes to keep everyone safe.
Once the bedroom is safe, if we look at pharmaceutical treatments to dial back the severity and frequency of these episodes, doctors usually weigh two main options: melatonin and clonazepam. Melatonin is very often the preferred starting point, basically just because it has a much better side effect profile. Clonazepam has been around for a while, and it definitely works, but it comes with some baggage, especially for older adults. You run the risk of daytime sedation, balance issues, and some unwanted cognitive effects.
Now, if we're dealing with secondary RBD, meaning it was triggered by a specific medication, there's a different route. Certain antidepressants, particularly SSRIs and SNRIs, can actually unmask or worsen these RBD symptoms, so carefully adjusting or even discontinuing those medications, always under strict medical supervision obviously, can often dial back or completely ease the dream enactment.
As the experts at My Sleep Scoring always emphasize, healthy sleep protects your brain health. REM sleep behavior disorder is this fascinating, undeniable proof that sleep isn't just downtime. It can literally be an early warning system for your entire nervous system. It leaves us with a pretty provocative thought to chew on. If your sleep is a window into your future brain health, what crucial secrets might your own nights be trying to reveal to you?